So today we're going to be doing what's called a MicroPeel. It's a light exfoliation, no downtime, it's easy on the skin and easy on the schedule. It'll probably take about 20 to 25 minutes. And right now I'm just cleansing the skin and getting his skin prepped for the treatment. Next I'm using a medical grade acetone to degrease the skin. It will remove that lipid layer that's on our skin naturally. It removes any oils, lotions, any makeup residue or anything that's on the skin, sunscreen, and it will help dehydrate the epidermis so that you get a good exfoliation and all that dead skin comes off. On some patients you'll actually notice that you get a lot of dead skin off based on their product use at home. If they're heavy retinol users, sometimes their skin needs a nice exfoliation. And then on the contrary, some people who don't exfoliate a lot will have a lot of dead skin come off too. So it's great to come in for a treatment and get all of this buildup off of your skin. Your skin will look better, it'll feel better, it'll be brighter, and you get an increased cellular turnover when you take all of this off. If you can get into the hairline a little bit like we can on Matthew, where it's still nice and smooth here, we'll go with the hair growth rather than against it, just because men do tend to have a little bit more coarse texture in this beard area. It will feel more comfortable to the patient to always go with their hair growth instead of against it. So now I'm going to be applying an acid solution to Matthew's skin. And don't let the word acid scare you. Acid just means it's a lower pH than your skin so that it will penetrate. Because your skin is designed to keep everything out, so in order to get it into the skin, you use some of your basic science that we know, and your skin is more at the neutral level, so we use something that's more acidic to get into the skin, or an acid. And all acids are formulated differently. They have different pHs, different molecules in them, and different solutions. So what I've chose for Matthew is a solution that is nice and light. He's probably feeling maybe just a little bit of tingling, a little bit of activity, but he won't expect to have any peeling or any downtime from this. But anytime you use something that is more acidic to the skin, you may notice a light flake, maybe a little bit of dryness or tightness, and that's normal, and that should last just a day or so. Now I'm finishing with a sunscreen, and Matthew can repeat this treatment in 4 to 6 weeks as maintenance, and it will help with oil control, acne breakouts, brightening of the skin, texture, and just overall health and condition of the skin. So it is important to stay on a maintenance plan where you are coming in regularly so that you will get the results that you're looking for. So tonight I recommended that Matthew skips any heavy exfoliation. His skin is prepped and exfoliated. He doesn't need to go home and scrub or anything like that. So I told him to take care of his skin just for a night or two by washing gently and maybe using a moisturizer or a hydrating serum. And then in a day or two, when his skin feels more hydrated and more comfortable, he can start back up using retinol products, salicylic acid, scrubs, anything that is a little bit more abrasive to the skin. But you do want to give it just a day or two to kind of rest and calm down. Because I did the dermaplane with the light acid solution, we took all of that dead skin off for him, so he doesn't have to do that when he gets home. I just don't want him to get too sensitive, so he gets a night or two off of all that exfoliation.
Treatment's completed, so how was that?
It was great. The dermaplaning had a light scrape to the face, no pain at all. When she applied the solution, there was a little tingling sensation, but no pain at all as well. And now that it's all complete, I feel fresh. My face feels nice and tight and clean and ready to go.